Abuse and neglect. Abuse is defined as the willful infliction of physical pain or injury or the willful deprivation by a caretaker or of services which are necessary to the person's health or safety. The term also includes the use of offensive language or act to provoke or upset an individual or subject him or her to humiliation or ridicule. This can include physical abuse, sexual abuse, emotional and verbal abuse, neglect, exploitation, financial abuse, and abandonment. Neglect is defined as the failure to provide services which are necessary to maintain his or her physical and/or mental health, or failure to provide arrange such necessary services by a caregiver. This can include medical neglect, inadequate supervision, lack of basic needs such as food, clothing, and shelter. Exploitation is defined as the process of taking advantage of a person for monetary, personal, or other benefit, gain, or profit. Abandonment is defined as the willful forsaking or desertion of a person by the caregiver, neglect of those duties by the caregiver or other responsible person. Sexual abuse is defined as sexual contact or encouragement of sexual contact between a paid or volunteer staff and an individual regardless of consent. Sexual contact or encouragement of sexual activity with someone who cannot consent is always considered abuse. Who is at risk for abuse and neglect? Those at the greatest risk include children under 18, the elderly, persons with physical and intellectual disabilities, and mental health and addiction clients. The risk factors for abuse are dependence on caregivers for ADLs and IADLs, social isolation, multiple medical problems, elderly caring for the elderly, cognitive impairment, caregiver stress burnout, history of family violence, lack of resources, substance abuse, and increased dependency on the caregiver. Child abuse and neglect. Child abuse is a physical injury, not necessarily visible, or a child under circumstances that indicate that the child's health or welfare is harmed or at substantial risk of being harmed. Child neglect, the failure to give proper care and attention to a child, including the leaving of a child unattended under circumstances that indicate that the child's health or welfare is harmed or placed at substantial risk of harm. Facts about elder abuse. Elder abuse can occur in all families regardless of income. 2 out of 3 of elder abuse occurs by family members. Elder abuse can be masked by certain diseases common to the elderly. Caregiver stress can lead to abuse, and not turning a bedbound patient is a form of neglect and abuse. Indicators of possible physical abuse and neglect are bruising, burns, lacerations, welts, fractures with poor or no explanation or inappropriate follow-up care, inadequate or inappropriate administration of medications, unexplained difficulty walking, sitting, or sleeping, weight loss, dehydration, and malnutrition. Indicators of potential emotional abuse are ambivalence, deference, passivity, explicit or observed fear of the caregiver, hesitation to talk openly, implausible or conflicting stories, anger, denial, non-responsiveness, anxiety and agitation, sleeplessness, and self-soothing behaviors such as sucking, biting, and rocking. Physical indicators of possible neglect are soiled, torn, improperly worn or inappropriate clothing, skin breakdown, odor of human waste, wandering, absence of functional aids, weight loss or dehydration, and untreated medical conditions or injuries. Environmental signs of possible neglect are excrement, plumbing or heating problems, copious amounts of trash, infestation, expired medications, absent or spoiled food, no telephone or emergency call system. Financial indicators of possible neglect are unpaid bills and shut-off notices from utilities, frequent checks made out to cash, bounced checks, absent or confused information about finances, charitable giving that exceeds resources, personal belongings or credit cards are missing, and the caregiver's name is added to a bank account. Indicators of possible exploitation are sudden isolation from friends or family, a sudden change in a lifestyle, loss of valuable possessions, expensive gifts from clients to caregivers, recent acquaintances express excessive affection, caregiver seeks exchange of assets for care, forced signatures, accusations from one family member against another, client confusion as to disappearing assets, a change in stable banking relationship, and a sudden increase in debt. Reporting abuse and neglect. Possible indicators of abuse or neglect may not always turn out to be abuse, but are always important to evaluate. The mandated report must only have a reasonable suspicion that an individual has been mistreated. No evidence of proof is required prior to making a report. Mandated reporters. Connecticut has developed a list of professionals who are mandated to report any suspected abuse or neglect. The extensive list can be found online. The law was updated in 2015 and now includes any person paid for providing care to patients by an institution, organization, agency, or facility, including any employee of a community-based service provider, senior center, home care agency, homemaker companion agency, and EMS personnel. Examples of mandated reporters are doctors, nurses, social workers, therapists, police officers, clergymen, and homemaker companions. Any person who makes any report cannot be held liable in civil or criminal court when the reports are made in good faith. Failure to report is considered a misdemeanor and is punishable by Connecticut law. There is no one centralized agency in the state of Connecticut to report abuse or neglect. It's important to follow the policies. All cases of suspected abuse and or neglect will be reported and investigated promptly in compliance with the state law and regulations. The reporter will be required to provide their information. However, they can request to be anonymous to protect their privacy. Reporters are under no legal obligation to inform parents. Report any alleged, suspected, or witnessed abuse to a supervisor immediately. Who do I need to report to? There are 3 major agencies that handle the investigations of abuse and neglect. Who you call is based on age and diagnosis as follows. To report for anyone under the age of 18, you should have the report made to the DCF, Careline, and or law enforcement agency. The oral report must be made within 12 hours and a written report should be submitted to DCF within 48 hours. To report for anyone with an intellectual disability between the ages of 18 and 59, you should have the report made to the Office of Protection and Advocacy. Oral report should be made within 72 hours and a written report to follow within 5 days. To report for anyone age 60 or older, you should report to the Connecticut Department of Social Services, Protective Services for the Elderly. The oral report must be made within 72 hours and a written report to follow within 5 days. Your supervisor will assist you in making reports to external authorities. When and what do I report? The sooner a report is made, the sooner it can be investigated. It is helpful to gather the information they will request and call as soon as you can. The information typically includes the name, age, and gender of the alleged victim, as well as the name and address of their caregiver, the extent or maltreatment, neglect, the approximate date and time it occurred, any past abuse or neglect you are aware of for this individual, and any other information that you could provide would be helpful. Abuse and neglect allegations. If a patient makes an allegation of abuse against any employee, that employee must be removed from all cases until the agency investigation is concluded per regulations. Retaliation and whistleblower protection. A whistleblower is someone who has knowledge of corruption, unethical practices, violations of laws, mismanagement, gross waste of funds, abuse or authority, or danger to the public safety occurring in any state department or agency, quasi-public agency, or any state contract, and who reports such knowledge. Connecticut law protects whistleblowers from retaliation or threats of retaliation for having made the report. Is this situation reportable? Someone you are working with tells you how sorry they are for being in a wheelchair and needing help. When you ask them why they are upset, they tell you that they heard their mother tell someone on the phone, "It can just be so hard with all these medical needs. I feel like I can't keep up." That situation was not reportable, so although what was said may have been hurtful to the patient, it was simply a comment made, and the comment was not meant to provoke or upset an individual or subject him or her to humiliation or ridicule. Is this situation reportable? During a home visit, you notice that there is extra medication in a patient's pill box. Their daughter typically visits daily after work to dispense the medication to assure it is taken accurately. You ask your patient about it, and they tell you that their daughter forgot to stop by and give it to her. She has been really busy. She says that this happens often. Yes, that situation was reportable. Failure to supply necessary food, clothing, shelter, or medical care when reasonably able to do so is considered neglect and is reportable. Is this situation reportable? You are helping an elderly patient when you notice large bruises on their upper arm. When you inquire about their origin, your patient tells you they are nothing, don't worry about it. When you ask her daughter, she denies having any knowledge of where the bruises came from. Yes, that situation was reportable. Any physical or mental injury not reasonably explained by the patient's history of injuries is considered an injury of unknown origin and should be reported for potential abuse. Is this situation reportable? An individual you are working with loves dancing. You learn that their in-home staff member has been taking videos of them dancing and sending them to their friends because they are so funny. Your patient thinks that staff member thinks that they're a good dancer, but you realize the staff is making fun of your patient. Yes, that situation was reportable. The staff member is behaving in a way that subjects him or her to humiliation or ridicule. Also, it is illegal to tape someone without their consent, and if your patient is a minor or has a conservator, they cannot give permission to you for you to publicly share a video of them. Ethical issues. If ethical issues arise with a patient, please contact your supervisor right away. Ethics Advisory Committee will be convened to discuss any ethical issues. The members of this committee are the MD, the lawyer, the administrator, and the clinician.